Okay, we're going to get started. So I'd like to welcome everybody to today's online webinar entitled Electronic Medical Record for Maturity Model and EMR Process Reporting, EPR, for Primary Care Clinicians, presented by Ibrahim Omar. Omar is a primary care nurse practitioner with a Bachelor of Arts degree in English and Economics from the University of Delhi in India, a Bachelor of Science of Nursing degree from McMaster, and a Master of Science in Nursing degree from York University. He has a strong IT background. He currently works at the Waterloo Regional Nurse Practitioner-led clinic and is a Nightingale super user with extensive experience providing EMR training. He is also a consultant for eHealth Ontario and has been an RNAO best practice champion. Ibrahim is one of our nurse peer leaders for the OntarioMD RNAO Collaborative Nurse Peer Leader Program. Please note that this webinar will be recorded, and the recorded session will be posted on the RNAO website. Feel free to also contact myself, Tanya, to obtain a recorded link. At this time, all participants are in listening mode. The presentation portion of the session. There will be opportunities to ask questions at the end of the presentation, and there are two ways to ask the question. The way is to type in your questions in the chat box, on your screen. The second is to unmute your line by pressing *7 and ask the question verbally. So thank you for joining, and I'll turn you over to Ibrahim to begin. Ibrahim, just a friendly reminder to unmute your line by pressing *7.
Everyone hear me okay?
I do, thanks.
All right, thank you. Welcome, thank you, Tanya, for the kind introduction. Before the main discussion, I'd like to give a quick further background where I work. It will be relevant when I talk about EMR Maturity Model and EPR. I do NP-led clinic, as mentioned before, as a number of years, and since we have open clinic, I have been much involved in adoption and implementation phases of our current EMR. A multidisciplinary group where we have 7 NPs, 1 pharmacist, 1 dietitian, 1 social worker, 2 RPMs, and admin staff are working between 2 sites in Cambridge and Kitchener. I'll share personal experience of using these tools in practice. Hope that you will find them as useful as you did. Also, excited to show you these tools, which were only available online for physicians, but they will be soon available for non-physician staff, such as NPs, RNs, allied and admin staff. I think exciting news for all of us. Here a presentation. We'll EMR Maturity Model and EMR Progress Reporting tool. We'll discuss how you can use these tools in conducting an assessment of your own EMR use, and I share some of my experiences as I mentioned before. I'll discuss how you can identify gaps and opportunities for change regarding EMR utilization and how you should prioritize them. How you can develop an action plan to address those gaps, and give you an example of an action plan that was completed for our practice. Discuss the resources that you need for the implementation of the action plan. Finally, we'll discuss some steps regarding the evaluation phase. And for those of you who are nurses, have noticed that these steps similar to the nursing process. We start from assessment and diagnosis, and then move on to planning, implementation, evaluation. But in this case, it's not about the patient, but you're using this process to address your EMR issues. EMR Maturity Model and EPR. Let's solve this question. Why electronic medical records, first of all? I all agree to some extent that the use of an EMR improves efficiency in our daily work. It improves measures with prescription use and interaction checking. It enhances effectiveness in terms of chronic disease management, and it aids greatly in the organization of records. With the use of EMR, we can better communicate with our patients, such as discussing the trends of their literacy and other health indicators over time. Finally, With the use of EMR, you don't have to worry about ineligible handwriting anymore, but some of our clinicians are famous for. Studies will support the benefits of using EMR. EMR might increase accessibility to information required during the patient encounter. Since implementing the EMR, 94% of physicians enrolled in Alberta's program report that patients receive their test results faster, and 7% report that the test and investigations are no longer needlessly repeated. This counts the above benefits of an EMR. In 2004, OntarioMD was established to help physicians transition from paper records to electronic medical records. Over 2% of primary care physicians in Ontario have adopted EMR. Now that most of us are using EMRs, we face the challenge of how to utilize it in our daily work to its full potential. Nevertheless, learning do exist among us as clinicians when it comes to EMR utilization. I have from colleagues that add significant hours to their workday, and they're in the office after hours completing EMR notes. They have to do with the standardization of the diagnostic code, running reports, and use the features of their EMR. Some of us have EMRs now, and they're here to stay. We have to find ways to make it easy to utilize. Some of the challenges Ontario with direct input from OntarioMD physicians and clinic manager peer leaders. Develop useful change management tools, which are topics for today: EMR Maturity Model and EMR Progress Reporting, or EPR. So the maturity model is a roadmap that is designed to measure the effective use and value of an EMR. Most importantly, the model presents the current as well as the potential capabilities on EMR use. It has 5 levels of maturity. It's 2 basic functions. First, doing towards advanced functions. Now, EMR can be used at practice level, but it will also used at system and functional level. Is that by using the advanced features of our EMR, we should be able to further improve our admin and clinical workflow, our daily work environment less hectic and efficient. Represents those 5 levels of EMR maturity across 7 functional areas within a practice. This maturity level from the right to the left of the table, as you can see, requires a unique criteria to be prior to advancing. In plain words, it may advance to higher level, use paper in office. If becoming paperless and relying more on your EMR, also become environmentally friendly clinics with less papers to be shredded. Let's all areas from top to bottom the usability of an EMR in different aspects of our primary care setting. For instance, an example under practice management would be how you utilize the EMR in terms of appointment scheduling, billing, communication between staff, info management. For example of this would be encounter documentation, like use templates, stamps, and efficient documentation. Result management means that we should be able to get our lab diagnostic reports through the EMR. Diagnostic support, we have patient assessment tools embedded in EMR, such as PHQ-9 template scale or assessment tool that be easily available from the EMR itself. Planning support means if you are using for chronic disease management and so on. All this model puts all the developmental and functional aspects of an EMR use into a perspective. To the maturity model itself from bottom of the table going up, this means that the practice does not utilize any EMR at all. Papers are the only means of storing and accessing clinical information. One shows that there is a computer and it is only used for basic record keeping. Level 1 example of it would be using the EMR for scheduling patients. Level 3, a good example would be utilizing your EMR for chronic disease management. Level 5 or more for integrated care. And at level 0 to 3 reflect EMR use at practice level. 4 and 5 reflect sharing data outside of the practice for integrated care. In level 5, you will have the ability to share patient records with specialists and hospitals from your EMR. So electronically sharing from your EMR the prenatal records with UNA and vaccination records with public health. Passport management, or HRM, is another OntarioMD product which enables your EMR to directly receive some of the patient's hospital records into your EMR. And this just puts an EMR at a maturity level of about 4. I'm not sure if your clinics already got HRM, but it will save lots of your admin and clinical time. So let's talk about EMR maturity model, and we know there's a model that shows the different stages of EMR utilization, how to actually assess our own EMR maturity level or EMR usability. To answer this question, OntarioMD came up with EMR Progress Reporting, or EPR, which is an assessment tool to assess the EMR maturity level of a practice. EPR uses 25 key measures, which are relevant to the 7 functional areas of the practice, which we saw table earlier. It allows you to conduct self-assessment of your current EMR use. Hence, EPR is a self-assessment tool that is measurement of an EMR utility level. If EPR identifies significant gaps in current EMR use, you can mark these gaps as potential areas for improvement. You will have a benchmark report that includes scoring along other relevant analysis. The study or the assessment tool is available both in paper as online. Online is available for physicians, as well as tools will be available for NPs, RN, allied health administrators. What types of using EPR? I find the EPR model to be valuable in not only assessing the uptake and use of EMR, but also in paving the way for connecting and collaborating among multidisciplinary team members. For example, when I conducted the EPR, I found that every staff in our clinic has an important role in improving EMR utilization, from admin staff to NP and other clinicians. Another, you can mark or measure your own EMR use improvement, and not only other healthcare providers, but also other practices across the province, with assurance that you're not alone working towards advancing your EMR utilization. You to customize and personalize your goals and to address it in an organized fashion. Your EMR use improvement time and see if you need any improvements. You may earn Mentor C credits from completing the EPR, and also for physicians, it is for the continuity of funding for their EMR. Last but not least, you can have access to peer leader programs where free mentoring is available by expert physicians, nurses, and office managers, which we'll talk about it more in the next slide. For the 25 key measures that an EPR entails, very comprehensive, as you can see, and it encompasses all aspects of an EMR use in a primary care setting. As you see, it covers all 7 functional areas of a practice: administrative use of EMR, such as billing, running reports, superior use, such as counter documentation, lab, and post-chronic disease management. So it has questions about each of these key measures, and you're able to assess each measure after conducting the EPR. Snapshot of an online EPR questionnaire. As you can see, the question has 5 levels. correspond to EMR maturity model. Side of that slide, in the second column, you click on EMR use, so where I'm now, and then in the next column, you would choose which level you'd like to be next. For example, I answered the question for chronic disease management section. I answered that we are at level 0 because we are not using any templates for chronic disease management, such as diabetes in our clinic. So where to be next was that we should be able to use the EMR to manage at least one chronic condition, such as diabetes condition, using flow sheets and templates. How to start it? In OntarioMD portal, the EPR application, answer the question, generate printable charts to see your results and progress. Any account yet, and not a physician, you should be sponsored by a physician or an nurse practitioner lead to log in. Follow instructions in the portal or OntarioMD support for assistance. And assessment tools, the paper version of it is also available. I have to take the paper version of EPR myself and found it easy to complete and was able to analyze the data as well. EPR process, to complete the assessment, review the results. You can utilize the resources through OntarioMD and RNAO to make improvements in those identified EMR-related issues. So we continue to discuss an example of conducting EPR in our clinic. I'd like to pose this question to all of you. What is one feature that you'd like to address with your EMR use? Some of us may already have an idea of some EMR issues even before conducting an assessment tool. The assessment tool like EPR can still be used as a guide and also for reference to compare in future. Here is the 25 key measures again. Please look at them and see which one pops up as an opportunity for a change in your practice. And to add, you could star 7, I believe.
Yeah, your line, press star 7.
Sure.
I'd like that question.
Any thoughts? Let me call of examples. For instance, here under evaluation and monitoring, whether you're doing good with running reports, whether you can continue to plan your practice in case of a failure, and chronic disease management, if you have proper flow sheets for diabetes, CHF, TD.
One thing that a lot of practices are struggling with is developing templates and using the reminders and alerts. I guess that would fall under some of the practice issues.
That's right.
There's a question that's been posted from a nurse educator wanting to implement EMR usage into their nursing curriculum.
Sure.
Ask her to answer your question.
All right. Yeah, I'll answer that question at the end. Sure. Yeah, no problem.
Certainly, from our perspective, number 8, the nomenclature consistency, and is a big one with all of our physicians and our IHPs. Well, hospital summary information is a big one for us.
Sure. Good. What it is that you have already diagnosed the issues with your current EMR use. Now it's time to address them. Now I'll talk about how we tackle the issues highlighted by our EPR results and how to address them. So, and then it will give you some learn about the process, present in an organized fashion. Conducting the EPR in our practice, we found these gaps and opportunities to improve our EMR. Same apps about templates that was mentioned before. We were in level 3 when it came to medication prescription. Because we use the drug interaction, sent our prescription from the EMR, we have fields of medication. Our level 2 key measures were appointment schedule, registration information, and lab management, which means that we get our lab reports electronically into our EMR. We have electronic of our lab requisitions, and we also have favorite list of lab requisitions saved in our EMR. We have planned our business continuity plan in case of a power failure. Finally, I can see here in red, in level 0 for chronic disease management. These that we were not utilizing the EMR at all when it came to chronic disease management. Example of the electronic ER result. Here the colors correspond to different levels of EMR maturity. In this case, the different colors make it easy to analyze the data. The previous I did the analysis myself, but if you do the online version, it will look something like this. Key measures, we found that we are in lower level in 4 areas in our practice, and at higher levels in other areas. The color indicates 0, and dark green indicates levels are higher function. We have in the following areas indicated in red. Communication coordination. We are not using the EMR to send electronic notification or assign tasks to front staff. Still using the sticky notes, so our goal was to move to the next step and use the assign task feature of our EMR to communicate with front staff. We were using the EMR to manage at least one chronic condition such as diabetes. Our goal was to use diabetic flow sheets and templates. We have a pre-completed electronic version of the commonly used imaging requisitions embedded in our EMR. We want to set up direct reminders and alerts for managing routine preventive screening tools, such as for EBT, mammogram, and all. As a group, we personalized goals in our to address the 4 key measures out of the 25 key measures. And we chose chronic disease management address first, specifically diabetes. In order to address the diabetes care in our team, we devised this action plan. It outlines our goal and helps us to stay focused on our goal, our progress. So that each diabetic patient needs to have a flow sheet embedded in their CPP. We had a start and an end date. We had responsibilities of each member written. We put responsibility from admin staff to NPs, RPNs, and we had a diabetic working group as well. You can add as much details as you'd like in your action plan. Some of the the RNAO peer leaders, OntarioMD change management staff, Canadian Diabetes guidelines, our EMR vendor. What's an action plan? It is essential to mention the obstacles you may face. Action plan template is also available through OntarioMD. We call it action plan because we clinicians like to devise action plans for COPD, asthma, and all for patients, but in this case, you'll make one to your EMR use. I've used the EPR to detect gaps in your practice, and you have your action plan and implemented it. And now you need to go back and evaluate. Here are tips on how to evaluate. Review each key measure after implemented the changes in your practice. Identify and communicate the improvements on periodic basis during a staff meeting. Identify any roadblocks that are hindering the progress and address them accordingly. On EPR on periodic basis, and review the action plan after the implementation of each goal, which will help you to assess improvements in that particular area or key measure. As I mentioned before, you know what your issues are with your current EMR use, but nevertheless, you may have difficulties in devising an action plan or putting the plan into practice to address the issue. This is where peer leader program comes into play. In the health, physician, and clinic peer leaders, peer leaders, but nurses and nurse practitioners like myself are part of the peer leader program. The nurse leader program is a joint effort between OntarioMD and OntarioMD. The peer support is free of cost. All primary care nurses and nurse practitioners, as well as physicians, allied administrative staff, you can call us, we can do site visits, as well as we can direct you to online resources. Peer leaders can help you from adoption to implementation phases of an EMR use. We can help you access EMR utilization resources. We have our own experiences and also best practices. We can come and use practice and discuss issues in person if need be. And we can share your learning tips and tricks to optimize your EMR use. There are series by nurse peer leaders about different EMR-related topics from October through December. Mine was the first one. There are about 4 upcoming webinars with really good EMR-related topics, all free of cost. eHealth Center of Practice is another online resource. There is for joining the community, and you can read or you can post questions. You can even share your EMR experiences so your peers can learn from you. The nurse peer will respond to your postings. They also share their experiences and post resources that are relevant to the use of EMRs in a primary care setting. There are more other resources from OntarioMD developed by your change management team. Here is the prioritizing key measures template. Plan template and resources support you in different aspects of your EMR use in your clinics. If you book or access a peer leader service, you contact Tony Costa, and her contact information is on this screen. If you can come back to the slide, and you can write down this information. From the presentation, I hope you take with you these key points. It is time to decide and agree which key measure to address first as a group. Try everyone in your practice. If you have an EMR super user, have to review one session. It's different, but they already have same features. Use the features that your EMR offers. Small steps to improve so you don't overwhelm yourself and celebrate every small success. So, key measure first, then address accordingly. Measure it and see if it works. Take few steps back and evaluate. You move forward. Utilize your MD EPR tool and plan template on your online resources. Contain lots of tips and tricks. Last but not least, don't forget that whenever you get stuck or have questions, concerns, there are peer leaders available to help you succeed. This is the presentation, and I can take questions now. Thank you.
If you have questions, please unmute your line by pressing *7.
Yes,
Alternatively, you can type them in the chat box. Questions?
How long did it take for you to develop a template for your diabetes program?
It doesn't take that long because, first of all, you need to have this written in a paper, and you should have all the diabetes guidelines, and then have the structure and the map in the paper, it's really easy to devise the template itself. And also your vendor. So if you have any technical question, you can call your vendor as well. But the process itself, the template, you need other team input as well, such as dietitian, you need your NPs and also RPMs. So it doesn't take that long to really make one. But the process, you have to go about the process with each team member. That's important.
Okay, thank you.
You're welcome. Thank you.
Thank you, Ibrahim, for your presentation. I have a quick question. I'm wondering if the slides will be available.
Sure. The slides will be available. I think Tanya
Yep,
will.
available. I can send them out to whoever was on today as well. The recorded session will be available online, and then I can send that link out as well. There's yeah, sorry, Ibrahim. There was a question earlier posted. I'm just up. It was online. I'm a nurse educator wanting to implement EMR usage in nursing curriculum. Do you have any information that you could provide to her, or?
Sure.
Schools?
Yes, we did reach most of the nursing schools. Ali is here also. I wanted to have a meeting with them or to include like EMR-related topics and nursing schools or in the curriculum. Sure, it is on our agenda. And if you'd like further information, I think it's good if you could contact Lee or myself and then further talk about it. Yeah.
Do you want me to speak a little bit more about the university and colleges?
Sure, please.
Okay, I'm Lee Mantini. I'm the senior nurse peer leader. We did, as Ibrahim was saying, we did reach out to some of the colleges and universities that are close to the peer leaders that we have. The best way to contact us is through Tanya Costa, RNAO, and she can get the information to me, and then I can determine how I can assist any of the colleges and universities, because we really do want to start reaching out to the students, because we want to make sure that they become leaders and advocates for the optimal use of electronic medical records in primary care. And we have worked with George Brown College and provided them with some one-pagers, some links and resources that they can use in their programs, and also an orientation PowerPoint we did for their students as well. So we're certainly happy to work with colleges and universities to make sure that there is more EMR content in the curriculum. So please contact RNAO about that.
Other question, Ibrahim. In your presentation, this is Emily Cooper from eHealth Ontario. You mentioned that there were 3 levels of EMR maturity. Just wondering, or 3 levels, if there are any beyond that and what they might entail.
Sure. Yes, there are 3 levels. The 3 levels, what means that you're utilizing your EMR within the practice. And the 3 levels, they're level 4 and 5. What it means that you're communicate through your EMR site of your practice. For instance, directly you can share the natal records, as I mentioned before, with OntarioMD, so you don't have to fax them, or vaccination records with public health. So it means that from level 0 to 3, you're utilizing your EMR within the practice, and then from level 4 and 5, it means that you're using for more integrated care, but outside of the practice, like in the community with specialists, with hospitals. And also an example that I gave about hospital report management, you will get hospital report, patient's report directly into your EMR. So that's an OntarioMD product which it enables your EMR to becoming about the level 4. Yeah, I hope it's clear. And
level 5 look like?
5 would be mostly like like with the public health. As I give you like you'll have more. It's a system level, and more. For instance, when you have a patient, you directly should be able to, from the hospital, should be able to see the CPP in your EMR. So it is more of a system and national, a system level, regional level that you use your EMR in a region on a regional platform.
There's also been a question online, which I'm going to read. So notification of results are easy for docs and NPs, but others do not get notified enough to know what the patient has something done and what they're looking for. That makes it difficult to manage the CMD, thus the test receive person further notifies as someone else on their team. Have people found a way to transition that more easily?
Sure. I suggest that if you could contact one of the peer leaders, like I'm not sure which EMR you're using or which you're with. So we have to, as I said, like we have to go through the process and see if EMR has that feature. And only the physicians, it should, other allied health and nurses be also able to see the alerts and reminders. So I would suggest that if you could contact one of your leaders, and then we should discuss it furthermore, depending on what type of EMR you have and the setup of your organization on the clinic.
Great, thank you.
Thank you.
Are there questions for Ibrahim? No, well, thank you once again, Ibrahim, for your great presentation and for taking the time out of your busy schedule to present. The slides will be available as well as the recording. So, and I wanted to thank all the participants for joining. Thank you.
Yeah, thank you.
Great.
Thank you.
And for coordinating this webinar.
Thanks. Take care.
Thank you.